Welcome doctors to my lecture. We are studying general anatomy. Today, we will discuss an important topic related to phonation, which is the anatomy of larynx. It is a very important conceptual topic and examiners' most favorite. Please don't forget to subscribe my channel. This is the general anatomy of larynx. Please have a quick look at the most important muscles and cartilage. Further, we will discuss every single one in detail. Remember, it is a very confusing topic, so having a good concept is very important for solving tricky MCQs. Stay focused. This is the posterior and the superior view of the larynx showing all the muscles, cartilages, and ligaments. Knowing these structures and their function is very important to know the physiology of phonation. The thyroid cartilage shown in green color is a hyaline cartilage structure located in the anterior neck region. It is part of the larynx, specifically the larger of the two laminae that fuse together in the midline to form the laryngeal prominence. The thyroid cartilage protects the vocal cords and plays a role in sound production during speech. The cricoid cartilage shown in the green color is a ring-shaped cartilage located in the neck that forms the base of the larynx and provides attachments for several important muscles and ligaments involved in breathing and speaking. The arytenoid cartilages shown in the green color are paired, pyramid-shaped structures located on the posterior aspect of the cricoid cartilage in the larynx. They serve as attachment points for the vocal cords and several important muscles involved in controlling sound production during speech. The muscular process of the arytenoid cartilage serves as an attachment for the vocalis and lateral cricoarytenoid muscles, while the vocal process serves as an attachment for the vocal ligaments as shown. The corniculate cartilages shown in the green color are small, cone-shaped structures located on the apex of the arytenoid cartilages in the larynx. They play a role in maintaining the rigidity and stability of the larynx during phonation and respiration. These cartilages play a very important role in phonation. The epiglottis shown in green color is a leaf-shaped structure located at the base of the tongue that helps prevent food and liquid from entering the trachea during swallowing. It also aids in sound production during speech by altering the shape of the pharynx and larynx. The epiglottis is composed of elastic cartilage and is highly innervated and vascularized. The Rima Glottidis shown in the green color is the opening between the vocal cords in the larynx. It plays a key role in sound production during speech and allows air to pass through the larynx into the trachea during respiration. The size and shape of the Rima Glottidis can be altered by the contraction and relaxation of various muscles in the larynx, which affects the pitch and quality of the voice. The Aryepiglottic folds shown in the green color are triangular-shaped structures that extend from the sides of the epiglottis to the arytenoid cartilages in the larynx. They play a role in the protection of the airway during swallowing by helping to seal off the entrance to the larynx. The Aryepiglottic folds are composed of mucous membrane and fibrous tissue and contain several important muscles and ligaments involved in the movements of the larynx during respiration and phonation. The vocal ligament, also known as the vocal fold, shown in the green color is a band of elastic tissue located in the larynx that forms the medial edge of the Rima Glottidis. It plays a crucial role in sound production during speech by vibrating in response to air passing through the larynx. The vocal ligament is composed of several layers of tissue, including epithelium, superficial and deep lamina propria, and the thyroarytenoid muscle. The tension and thickness of the vocal ligament can be adjusted by the contraction and relaxation of various muscles in the larynx, allowing for changes in pitch and volume of the voice. We will discuss it in detail in part 2. Stay tuned.